a health alert. A deadly virus thought to have originated in camels in the Middle East has turned up in Indiana in the first known case in the United States. It's called MERS, short for Middle East Respiratory Syndrome, and it causes severe acute respiratory illness. Close to 100 people have died from it so far, mostly in Saudi Arabia. So what does this latest case in the U.S. mean for people living in this country? Well, let's bring in ABC's Dr. Jennifer Ashton for more on this. So tell us about MERS. What is it?
Think of it like SARS, which is a respiratory virus causing acute respiratory failure in some cases, only believe it or not, it appears to be even more deadly. This is a brand new virus, you guys. It's only about 2 years old, so we're still learning a lot about it. As we said, it did start in the Middle East, migrated sporadically to some countries in Europe, and now made landfall in the United States. This was something we expected, but the CDC and the World Health Organization, the disease trackers, the medical detectives are working around the clock to learn more and more about this case.
It's like a scene out of the movie Outbreak. How contagious is it? We know that this man is in isolation now at the hospital.
Right. I mean, he's in isolation because he's hospitalized, but the CDC really thinks it poses a low risk to the general U.S. population. People who were on the plane that landed in Chicago, on the bus that went from Chicago to Indiana, they will be contacting those people just out of a sense of precaution. It's really close, prolonged contact, and we don't know that much about how it spreads person to person, only that it appears that it can spread person to person.
So we don't know how contagious that is. What are some of the treatments out there for it? Are there?
There really isn't. There's no vaccine yet. There's no direct antiviral medication yet, so the treatment is supportive. But people need to understand, if they've been to this part of the world where there are cases in the Middle East, they come back, they get symptoms of shortness of breath, fever, a severe cough, they need to alert them to a medical professional and tell them where they've been. People in this country, just precautionary.
So better to be proactive, though, if you're starting to feel these symptoms.
Absolutely not a cause for panic at this point.
All right, and we do wish this man well in his recovery.
Absolutely, and we'll be following it closely.
Yep. Jen, thank you.
You bet.